Hello, and thank you for joining us for another edition of the OHSU Parkinson Center Ask the Doc. I'm Diana, and we have Dr. Amy Hiller with us, and we're going to talk a little bit about stress and Parkinson's. So Dr. Hiller, is it true that stress could cause Parkinson's symptoms to worsen?
Thanks, Diana. That's a great question. There is some evidence that certain symptoms of Parkinson's clearly get worse with stress. So slowness or bradykinesia, we refer to it as. Freezing is often where people's feet get stuck when they try to walk. Those things seem to clearly get worse with stress. Tremor is probably the symptom that most people are most aware of getting worse with stress. And in my clinic, I'll actually try to stress people out a little bit oftentimes to bring out their tremor. An even more exciting area, I think, in terms of stress and Parkinson's disease is that stress may relate to the development of Parkinson's disease and even the progression of Parkinson's disease symptoms. So people who have more emotional stress may be at higher risk to develop Parkinson's disease, and then people who experience more stressful life events may be at higher risk for faster progression of their Parkinson's disease.
Wow, it sounds like stress really does impact Parkinson's symptoms. Is there some things that can be done to help manage or reduce stress in our lives?
There are a number of ways that you could approach stress. So there's very simple things that we could all just incorporate in our everyday lives pretty easily. One is exercise. We think that exercise helps reduce stress, and we know exercise has a lot of other wonderful benefits in Parkinson's disease, so this is a great way to incorporate things. Another option is simple breathing exercises can often be helpful. Meditation is another exercise that can be helpful, and this can involve a wide range of different approaches. More formalized things are things such as yoga classes. Also, meditation classes can be in a formal setting. And then there's also specific classes that are either done in a group, something like a mindfulness class. And then there's also an area called cognitive behavioral therapy that can focus on stress reduction. And this may be something that's done in a class setting, in a workbook type setting, or even with an individual counselor.
Well, mindfulness is kind of a hot topic right now, and I've heard a lot about it, but I don't think many people understand it. Can you tell us a little bit more about what it is?
Mindfulness can be a confusing topic, and not everyone defines it exactly the same way, but the overarching themes are that it's a moment-to-moment awareness to help reduce stress and improve coping. It's often done in formal classes that would focus on things such as meditation, yoga. There's also a big discussion part of the class where different people compare how these practices are going, what they're finding useful, and how they're managing, and again, trying to obtain this non-judgmental awareness, and then how they're doing with their stress reduction.
This seems like a really important topic. Is there any other research being done between stress and Parkinson's?
There has been some research specifically within mindfulness, two small published papers showing some benefit in Parkinson's disease. We've also done a very small class here in hopes of pursuing a larger research study looking at the effects of mindfulness in Parkinson's disease, both the motor symptoms of Parkinson's, how people are experiencing their stress, and also the cognitive symptoms of Parkinson's disease. And there's also other research going on to try to better understand this connection of Parkinson's disease and stress.
Well, thanks, Dr. Hiller, for this great information. I do think we should end this stressful interview with just a moment to take a breath, a big belly breath. Shall we do that?
That sounds great.
Okay. Well, I definitely feel better.
Me too.
Awesome.
Thanks, Diana.
Thank you for being here. I want to thank others for joining in for the OHSU Parkinson Center Ask the Doc. If you have any specific questions about your own situation, please contact a provider. If you have any questions that you want us to address in the future, please you can send us an email at pco@ohsu.edu or send information via Facebook or YouTube, and we can certainly address your questions on one of the next editions. Thanks for joining us.